Hi everyone, it's Dr. Steph. So this month I was part of a financial literacy talk for women, and while the finances of maternity leave was a very small portion of that talk, the majority of the questions were about mat leave. And it makes sense that this is the most asked question from women because it is very confusing. So to simplify things for my fellow women, I'm recording just the maternity leave portion of that talk for your reference, because when you take mat leave, you can have this knowledge early so that you can plan ahead and not have delays in receiving your benefits. So if you find it helpful, remember to like and subscribe to be notified of financial events for women that I'm a part of, like this one, in the future. So in this video, I'm going to go over the basics of mat leave versus parental leave, how EI and employer top-up works, and since most of my audience are doctors and residents who often delay family planning due to long years of school, topics specific to them include when is the best time to take maternity leave and the pregnancy benefit program for Ontario physicians. All right, so while I've been using the term mat leave, I wanted to clarify the basic terminology a bit so we're all on the same page. Mat leave, also known as pregnancy leave, can only be taken by the birth mother. And based on the Employment Standards Act, you are entitled to 17 weeks of unpaid time off work. It can begin on or begin before the due date or on the date that the baby is born. Now, mat leave is different from parental leave, which refers to the leave you take after you give birth. So this can be taken by the dad, so parental leave can include paternity leave. Now, parental leave has two options, standard and extended. In the standard leave, if you are the birth parent, you can get 35 weeks. If both parents take leave, then you can receive 5 additional weeks for a total of 40 weeks, with any one parent not taking more than 35 weeks. In the extended option, it's about 61 weeks leave. If both parents take leave, then you can get 8 extra weeks on top of the 61, with one parent not taking more than 61 weeks. If you pick one option, you can't switch to the other option. Now, if you have a miscarriage in the 17 weeks before the expected date of delivery, you can either get 12 weeks starting from the day of miscarriage or 17 weeks from the date you started leave, whichever is longer. So now let's talk a little bit about EI, or employment insurance. You may have seen it taken off your paycheck, and it's a small percentage of your income that you pay into so that if you were unemployed for whatever reason, you can access benefits. Now, you qualify for EI if you have worked at least 600 hours in a salaried job over the past 52 weeks. During maternity leave, you can get EI for up to 15 weeks for 55% of your weekly earnings, and you can start claiming the payable benefits as early as 12 weeks before your due date. There is also a waiting period of about 1 week before the benefits are paid out. During parental leave, if you take standard leave, it's the same rate and you have to claim it within 12 months after the week the child was born or adopted. But if you decide to take extended leave, it's the same overall pay as standard, but just stretched out over a longer time and must be claimed within 18 months. Some employers will give you something called a top-up. Like in the case of our hospital residents, they can get tops up to 84% of their regular weekly earnings, but this percentage changes based on your company. Remember, all maternity and parental leave benefits do count as taxable income. So you'll be getting a T4E, Statement of Employment Insurance and Other Benefits tax slip for your tax filing. To apply for EI, the Government of Canada website has a step-by-step list on what to do, and calling Service Canada to speak with a person is helpful as well. So a popular question in the medical or in any professional community is, when is the best time to take mat leave? The general answer is that fertility isn't something that has a perfect timing. And especially in fields like medicine, where you're in school for like 10 years and have debt, waiting until you have your house and finances in order may not coincide with the time that you're most fertile, which is usually in your 20s. Not to mention, by the time you're out of student debt and ready to have kids, you might be faced with infertility. Even though there are huge advances in fertility treatments, many of these options are quite expensive, costing in the thousands to tens of thousands. But if we were to talk about timing mat leave purely from a financial perspective, comparing between having a child in med school versus residency versus staff, well, so if you were to take mat leave in med school, to put it bluntly, there's not a lot of pregnancy leave support and may be an area for future student advocacy. It kind of varies depending on the leave of absence policy at your school. Now, residency is generally probably the best time purely from a financial perspective due to this top-up. And it can vary based on which year you're in. So you might get a higher top-up if you're in like PGY9, for example. As a staff physician, there is a benefit program which I'm going to touch on in the next slide, but it does not pay as much as what you get in residency. The caveat is that some family physicians in capitation models might have higher pay than that program through their capitation. But you can't just like leave your patients when you take mat leave. So there is the frustrating task of finding a locum to cover your practice. So staff physicians in Ontario, and feel free to share in the comments what they do in your province if it's not Ontario. The program is called the PPLBP, or the Pregnancy and Parental Leave Benefit Policy. This comes out to be approximately $1,300 per week over 17 weeks as of April 2022. So with the PPLBP, you can begin your leave as early as 5 weeks before the expected date of delivery. And if you need to begin your leave earlier due to a health issue, just make sure you show a letter from the OB or midwife. Now, I use dotted lines to show that you don't have to take leave consecutively, unlike the EI program. You just have to take it in 7-day increments from Sunday to Saturday. The 17 weeks has to be completed within 12 months of the child joining the parent. This is important to know because there can be blocks of time where we can't line up locum coverage, and then the only option is to come out of parental leave and then cover your own clinic. So the non-consecutive leave allows for the flexibility for doctors to jump in and out of work. So I mentioned the $1,300 per week in the last slide, and this is calculated as 75% of your past 12 months of eligible income. And I use this term a lot, so what does this term mean? It's stuff like your billings or any income made through OHIP or clinical services. Private work or teaching stipends are considered ineligible, and there's another whole list of that other ineligible income, and those don't count towards the 75%, the billings. So most doctors will make more than $1,300 per week at 75% of their weekly income. But for those that don't, remember that for those that don't, then they might get less than the $1,300. So remember, if you are currently on leave and you're making more than $2,600 per week, so the $1,300 plus, let's say, more than $1,300 in capitation or any other forms of eligible income, then the $1,300 from the PPLBP will get reduced dollar for dollar. If you are incorporated, the PPLBP will get paid personally and not to the corp. However, incorporation can provide a benefit in pregnancy or parental leave to help smooth out the fluctuations of income. So for more info on that, check out this video, which I'll link above and in the description below, on should I incorporate to determine whether this is the right decision for you as an additional income smoothing during your pregnancy leave. And then to apply for the PPLBP program, be sure to check out this website, which I've linked, and download the PDF application. And if you're a resident in Ontario, check out the Parental resources. It's a long read, but I hope this video kind of summarizes it for you. Finally, if you have any questions, resources that you found helpful, or pregnancy advice to share with other women, please leave a comment, and thank you for watching.